Hello, and welcome to this session of Spotlight on Chatham, brought to you by the Chatham County Democratic Party. These 40-minute sessions are intended to be nonpartisan conversations about Chatham County government programs and public services. My name is Vicki Shea, and this session is being recorded on May 18th, 2026. Our guest today is Jenny Christensen, Director of the Chatham County Department of Social Services. So thank you, Jenny, for spending time with us this evening.
Yeah, glad to be here. Thank you for having me.
I understand that the Department of Social Services, which I'll call DSS, is one of the largest departments in Chatham County government. And we'd like to hear about the many services that you provide. So I'll start by asking you to tell us about the program that has the largest enrollment, that touches the largest number of people in Chatham.
Sure. The largest program that we administer at DSS is the Medicaid program, and currently we have about 10,000 people in Chatham County who receive Medicaid. When North Carolina expanded Medicaid a few years ago, that created an opportunity for people to have access to the Medicaid program. And so Medicaid is a health insurance program for people with lower incomes. And so with the expansion of Medicaid, we increased our numbers by about 2,500 people. There were people in our community who didn't have any kind of health insurance coverage, oftentimes were working but didn't get employer-based coverage and didn't qualify for Affordable Care Act. And so the expansion of Medicaid in North Carolina allowed them to get Medicaid coverage. And the program's income based and looks at the number of people who live in your household, your income, and your assets to determine your eligibility for the program. In North Carolina, that's done at the local level at local DSS agencies, and in lots of states that's done through a state agency.
So 10,000 people in Chatham
Yeah.
are receiving Medicaid. Excellent. And what other programs does DSS administer that helps people who don't have enough money to take care of themselves or take care of their families in other ways besides healthcare?
Sure. Our second largest program is our food and nutrition program at the federal level. That's called SNAP, which stands for Supplemental Nutrition Assistance Program. Sometimes you'll hear people still refer to it as food stamps, but that's a food benefit program that is also income based. We have about 4,300 people in Chatham who qualify for that program. And it is designed not to cover all of your food expenses, but to cover a portion of those. And people will get like an EBT card, excuse me, that gives a monthly food benefit. And again, like Medicaid, your eligibility is based on the number of people in your household and your income to determine if you qualify and then what the size of your benefit is, how much of a benefit you get. We also,
So, go
sorry, go
ahead.
ahead. No, go ahead.
Well, an EBT card is like a credit card in size, and
Yes,
you give that at the grocery store, or I guess also at some other places that you can get food, like
yes.
markets.
Some farmers markets will accept an EBT card, yes, or a grocery store. Yeah.
Okay. And what other ways that people might need help and not have the money to take care of themselves or their families?
Sure. We have a child care voucher program, like a child care, we call it our child care subsidy program for parents who are either working or in school. And that provides a certain amount of money each month that goes to a child care provider who's participating in the program. So that allows parents to go to work and to make sure that their children are being cared for safely. We also administer two federal energy programs. They're called SIP and LEAP. SIP stands for Crisis Intervention Program. Sometimes we use the acronyms here at DSS, so I'll try to explain all of them. So SIP is Crisis Intervention Program. LEAP is Low Income Energy Assistance Program, and those provide assistance with people's heating or cooling source. So oftentimes electricity, sometimes gas, for lower income people. And then we have a child support program which um, allows parents to, we can work with parents to put child support orders in place or child support agreements in place so that custodial parents will get a monthly payment from a non-custodial parent. For some of our programs, participation in that is required, but that program is actually open to anyone, regardless of income. And the child support payments based on a formula that we get from the state.
Okay, so when a family is dissolving in one way or another, um, and the custodial parent has the child but doesn't have enough money to pay for the child or take care of the child, then DSS can provide some money. Is that what you're saying?
So it comes from the non-custodial parent. So a parent, so say a parent's a primary custodian of children, can come to our office, apply for the program, and what happens is they'll make an application. We will send a notification to that non-custodial parent saying that the custodial parent has applied, and based on that, we try to work out a voluntary payment agreement. And if there's not agreement on that, then we can pursue court action to have that ordered, so that it's based on a parent's income. So a payment will go automatically. It can be payroll deducted from the non-custodial parent to the custodial parent each month to help support the care of those children. And then we also have one local emergency assistance program at DSS, we'd call it emergency assistance, that can help with people who have a crisis. It's people are eligible it's one-time assistance, and it really helps us supplement the other energy programs that we have, because we typically run out of money before the end of the fiscal year, which is when we get our new allocation.
So that the crisis is sort of a one-time, I just don't have money
Yeah,
or
yeah.
for
Something has happened.
whatever. Yeah.
Yeah, something has happened and I can't pay my electricity this month, or a water bill. Sometimes it's a water bill, and we can provide some assistance to help with that.
But there's also a specific program. You said SIP and the one that starts with L.
Yes, yes.
That's different, but that can also help with utility bills.
Yes, correct. So crisis intervention program and low income energy assistance program both can help. Those are specifically for heating and cooling bills, not water. We did during the pandemic have a water assistance program, and that was administered by state DHHS, and the funding for that ran out, unfortunately.
Okay, right. And you said the child support program, there was no income eligibility or level for that. So it could be two very rich parents who couldn't agree on a support program, and so they could involve you.
Yes, there is an application fee, and it's based on a sliding scale. So if you're, for example, if you receive Medicaid, then there wouldn't be a cost for that. But if you're not eligible for other programs, you may have to pay a small fee based on your income.
And the eligibility for Medicaid versus eligibility for this one or that one or the other one, they're all different for the most.
They're based on income, but they're administered at the federal level by two different entities. Like food nutrition is administered through USDA, and Medicaid is administered through what we call it CMS, but Centers for Medicare and Medicaid Services. And so the eligibility for those two programs don't align exactly, but both are income based programs and
Okay,
take into account your household size.
right. Okay. Um, so one other question about that, and then there's
Okay.
so many different ways we could branch off. In terms of people who don't have enough money, if those are people who either can't find work, don't know how to do the work that's available, or for other reasons need support in starting to earn some of their own money. Is DSS involved in that at all?
Yes, we have two work programs that help people find work. The first program is specifically for people who receive a SNAP benefit or a food and nutrition food benefit. And it's now called in North Carolina More Than a Job NC. And the goal of this program is to help people who receive SNAP get connected to higher wage work. With, it's a program that's designed not to necessarily be a long-term program. So it helps people through either job training or education. And we have a partnership with Central Carolina Community College. So there's a person at Central Carolina Community College who would work with those students if they're participating in the program. And again, with the ultimate goal to help them get either a job or maybe a better job.
And I think there have been some changes either in place or impending that people, in order to continue to get SNAP benefits, had to increase the amount of time that they were either going to school to learn a better job or looking for a job or actually working. How does that work?
So in North Carolina, we've had a work requirement for food and nutrition. And with the passage of House Resolution 1, also called One Big Beautiful Bill, it expanded that work requirement. So it used to be until age 54, and now it's until age 64. And there were a few groups of people who were eligible for food and nutrition and didn't have to comply with the work requirement, including veterans, youth who had aged out of youth who have aged out of foster care, and people who are experiencing homelessness. And now they're no longer exempt from that work requirement. And so they also will have a work requirement.
But going to school to learn work skills would count towards the work.
Yes, if you're going to school, volunteer work also counts, or employment.
And how many hours per week is that required?
Um, I think it's 20 hours a week. It might be a little bit higher than that.
Okay, all right. And the number of people who have to do that in order to get their requirement has changed
Yes,
in the last year or so.
yes.
Okay. Um,
We have a second work program that I can also talk about, but if you have
yeah.
any other questions about More Than a Job, I can answer that.
Oh, go ahead. Tell me that one too.
Our second program is called Work First, and it's funded through a block grant called TANF, Temporary Assistance for Needy Families. And it provides a small monthly assistance payment to families. For a two-person household, that's $236 a month. If you have a three-person household, it goes up to $297. No, I told you wrong. It's $236 a month for two people, $272 for three people. So it's not a large payment to support families while they're seeking employment. There's a part of this program that we refer to as benefit diversion. And what benefit diversion does is if somebody has a break in employment, so oftentimes it's because someone's had a baby, for example, and can't work, they're able to get a one-time 3-month lump sum payment of that. So whatever their household size, they'll get 3 months of that that they can access to help them stay caught up on bills and living expenses. And there's also even though this is a work program, there's also sometimes we have grandparents who have custody of children, and those children may qualify for a monthly Work First payment. This again, a small payment, but it can help. We refer to it as child only Work First. So a grandparent wouldn't be required to participate in the work part of that, but could get a small amount of financial assistance through that program. And the program also has similar to our emergency assistance program and an assistance program that helps people with unexpected expenses with if they're receiving like if they've had an unexpected car repair and that's going to impede their ability to go to work, and it's an unexpected crisis, really, we can sometimes help with whatever addressing that, whatever that expense is, to help make sure that they can continue to work.
So there are all these different programs, and some people might qualify for a number of them.
Yes.
Um, ha how much work is it to get all of that for both the DSS and for the people to get all of that applied for and approved and integrated, and so that people know that they have some amount of income that they can rely on?
Yes. So there's a number so let me start by saying that we sometimes people are hesitant to apply because they're not sure if they're going to qualify. And we always encourage people to go ahead and apply, so that they will know definitively whether or not they would qualify for a program. And there's a number, you're right, each program has a separate application process. Our goal is to try to make that as simple as possible. So we offer a number of different ways to apply for programs. You can come into our office. We're open 8 to 5 every day. We keep paper applications in a kiosk outside our office, and we have a secure drop box where you can, if you wanted to fill out a paper application, you could do that and drop it in our drop box. You can apply over the phone. You can also, North Carolina Department of Health and Human Services has a website called ePass, and people can go online if they prefer to go online and start an application that way as well.
And you all are not the ones who decide if someone is eligible. It sounds as though you administer programs and funds that come from somebody else. Is that true?
Well, we don't decide on the policy. The policy is developed by North Carolina DHHS. Some of it's federally required, some of it's state's interpretation of how North Carolina is applying that. But we do make the eligibility determination at the local level. But we don't have, I can't just decide that someone at a certain income level will qualify for the program. That's definitely dictated by state and
Right.
federal.
But you're applying the formula in a
Yes.
way. Yeah.
Yes. And
Yeah.
we have a statewide eligibility system that's a, technology that we use, and we enter all of that into that system. So there's a record of income and household size and all of those
Okay.
things.
So do people tend to find the DSS people? I'm going to ask you about their titles in a minute. Do they tend to be like, what are the prevailing feelings? Are they embarrassed? Are they antagonistic? Are they scared? Are they just overwhelmed, or all of the above?
I think it can be all of the above, and we try to be really aware of that and sensitive to that, knowing that most people aren't coming to DSS because they're having a great day. Most of the time they're coming here to see us because they need help. I will say one thing, we started several years ago doing customer service surveys, and while we don't have a ton of people that complete them, one of the things that was really nice was how many people said nice things, that they really appreciated the help and that they felt like they got their questions answered and things like that. Obviously, not everyone is happy all of the time, and we continue to work at that. But we are aware of the stigma that's associated with our programs, and try to do what we can to make it easier for people to apply, with the recognition that there's some things that we can control and some things that we can't.
And would you be thought of as their social worker, or are there other terms or words that are used for all the people you work with?
Yeah, usually on the economic services side of our department, our employees are referred to as caseworkers. And then we haven't talked about our family services division yet, but
Right, right.
typically those those employees are referred to as social workers. There's a move away from using social work as the term just because there's title protection in North Carolina for people who have social work degrees. So sometimes they're referred to as social workers, sometimes they're referred to as child welfare workers or adult services workers. We're kind of it feels like we're in a bit of a transition right now.
Okay, well, I want to get the mechanics down, but let's go to the other thing that I think DSS is fairly known for widely in the community, which is dealing with reports of suspected child abuse or neglect. Tell me how all of that, what that looks like.
Sure. So anybody can call us. It's typically we take we take reports over the phone. So typically people call, although you can also walk into our office and make a report. And so anybody in North Carolina is considered a mandated reporter of child abuse and neglect. And we take the information from them and typically asking some questions. And then we use a policy that's developed by the Department of Health and Human Services and screen those reports with a supervisor to determine whether or not it meets the criteria to be screened in for abuse or neglect. And if that is screened in, then the report gets sent to a social worker on our assessments team. And so they'll go out and meet with the family, talk to the children, talk to parents, talk to other people who are familiar with the family, and gather information and then make a determination about whether or not there's those allegations are founded or not. Sometimes if we're really looking at child safety at that point, but we're also trying to put supports in place sometimes to help the family, making sure that kids are connected with medical providers and checking in with school folks and really trying to look holistically at the family with the idea that every family is different. And so if there continue to be safety issues, typically this is because there are concerns about serious substance use disorders, domestic violence, or like mental health, mental illness, or some combination of those three. We may refer the family to what we call ongoing services, or we may file a petition if we feel like the kids are unsafe and ask the court for custody. And so when we're awarded custody, we typically refer that to as foster care, although we're first looking at family or family friends or somebody who the children have existing relationship with as a placement option. We're talking to parents about who they might want us to call and ask. And then if we can't identify anybody that way, then we have foster homes. We license foster families here, and we'll call our foster parents. And so if we don't end up, I mentioned ongoing earlier, this would be pre-foster care or hopefully never need foster care. We're working with those families usually between 3 and 6 months, and then in foster care, we're typically involved for at least the federal standard is we're looking for permanency for that child within 12 months, and sometimes we're asking the court for an extension if a parent is still in substance use treatment and doing well but just needs more time before they're ready. Those kinds of scenarios, and then if we can't reunify children for whatever reason, we also have a couple of adoption social workers who work with kids who are legally cleared for adoption.
Okay.
That was very high level, but that's kind of, we call it our child welfare continuum, and that's kind of our continuum of services that we offer.
And in really difficult situations where it seems as though the child is possibly in danger, does the social worker go in pairs to the home, or is there a sheriff deputy that goes with them? Or, I mean, there could be dangerous situations, I imagine.
Sure, and sometimes we're talking to the reporter about that information. When
The
we're
reporter, the person who
the
told.
person who's making the Child Protective Services
Yeah.
report to get a better sense of potential safety issues if there are any. So sometimes, yes, oftentimes social workers are going out in pairs, and if we know that there's a safety risk, then you know, that we're concerned about
Yeah.
safety, then we will call law enforcement and they'll accompany us to the home.
And you used a term that I think is really important that people need to be very clear about. What's a mandated reporter?
So a mandated reporter means that no matter who you are, if you have a concern about a child who may be experiencing abuse or neglect, you need to call us, or you can call any county and make a report. And you can do that 24/7. We have somebody on call all the time when our office is closed. And you can make that report anonymously. You don't have to tell us who you are if you don't want to. But if you do want to know whether or not the report was accepted, we can take your information and let you know that when you make the report.
And let's try publicizing the phone numbers.
Yes, yes. I always forget these. So during the day, you can call our office, which is 919-542-2759, or we have a hotline, which is 919-642-6988. And if you are calling something in after hours or on the weekends, so after hours meaning after 5, or if it's a holiday like the 4th of July, for example, you would call our emergency communications center. Then if it's an emergency, call 911. But if it's not an emergency and it's after hours, you would call 919-542-2911 and ask to speak to the social worker on call. And it's the same process for adults or children. I know we haven't talked about adults yet, but
Right. Yeah, there's so many ways to go on this. Okay. So you mentioned the kiosk outside your office. So tell us where the office is, and would those phone numbers be available outside the office? If people can't remember the numbers of their.
yes, that is a good. I don't actually think it's outside our office. That's a great idea, though. Yeah, our office is at 102 Camp Drive, so we're right next to Flora Food Pantry. It's a white building with a green roof. And we also have, you can Google Child Protective Services report Chatham County, and it'll come up if you can't remember the number. Or
Okay.
you can go to the county website and go to social services, and there's instructions on there as well.
Right. And all of those work, and that's how a lot of people live, but a lot of people don't live with Google or online
Yeah. Yeah.
or access, but
Yeah.
might have phone numbers.
Yeah. Yeah. So just calling the Department of Social, but you can call just our main number and ask to make a report.
Okay. But
Yeah.
that is a good idea to have it out physically outside.
Yeah. Yeah. I'm writing this down so I don't forget. Okay. Thank you for the suggestion.
Yeah, you're welcome. So there are adults who are abused or neglected and they no longer have the capacity to protect themselves or take care of themselves as they used to. So
Mhm.
what can people do if they see that, and what can you do about it if they call you?
Yeah, so we have several different programs that serve elderly and disabled adults. So adult protective services are specifically for situations where there are concerns about abuse, neglect, or we also talk about exploitation with adults. So, and we've said this, but everyone's a mandated reporter in North Carolina for adult protective services as well. So it's a similar process. If someone calls us and makes a report, and if it meets the criteria, then we will conduct an evaluation to determine if there's a need for protective services. So we make home visits, talk with the adults, talk with other family members, talk with other people who might know that person. And sometimes this results in court action. So we might seek permission from the court to free someone's assets if there's concerns about exploitation, as an example. we you touched on this in your question, but I think something that's a little bit confusing is that we can only get involved through adult protective services when the adult is considered to need protection. So this means that there's a health condition, a mental health condition, or some other type of disability that impacts decision making. We see people oftentimes living in kind of less than ideal circumstances, but if they're making decisions that and have capacity to make decisions for themselves, there's not any thing that we can do necessarily to intervene other than talking with them and trying to connect to resources.
Okay, but could in those situations, either for children without any kind of identifiable family or adults, might you be appointed the guardian of that
Yeah.
person?
So in North Carolina, DSS is we're kind of considered the guardian of last resort. So if it's always better if there's somebody available who knows this person, who has a relationship with this person. It doesn't have to necessarily be a family member, although often it is, or someone who has, a friend, a neighbor. The court can appoint other people, but when in the absence of someone who is willing to serve as someone's legal guardian, then the court will appoint us at DSS, and we work with that person and try to understand their wishes and try to connect to family. We're always looking for people in that person's life, maybe that's somebody that we weren't aware of that they had a relationship with because they haven't been able to communicate that with us. And so we're always looking for other people who have a relationship who could serve as a guardian. But again, if not, then we will continue to serve that person as long as they need it.
Okay, just a few more questions. In terms of, it sounds as though, in terms of the funding of DSS, it sounds as though a lot of the funding is there's federal money and I guess there's some state money involved. To what extent does Chatham County financially support DSS?
Chatham County provides significant support to DSS. So we receive a combination of local, state, and federal funding, with most of our funding coming from either federal funds or local funds. So our budget, for example, we have a $17 million budget each year, and 6 million of that is covered with state or federal funding. Out of that 6 million, about a little over 400,000 of that is state funding, and the rest of that is federal funding. So,
and the rest of the 17 million comes from the county?
yes, yes.
Okay.
And all of these programs are mandatory programs to have in the community, with the exception of our emergency assistance program that I described earlier. And then More Than a Job, the food and nutrition employment program, is a federal program. We're not required to have it in every county, but we do offer that in Chatham County, again, to help people get connected to work or higher wage work.
And how big is your staff currently?
We have about 105 people who work at DSF. So we have a large
They're
crew.
all in that one little building?
Well, we had a little building, and then about almost 20 years ago, we added a second building in the back. So it's actually two buildings that are connected.
Okay.
Yeah, we used to be all in the front building. When I came to Chatham County in 2007, I worked in we had like a double wide annex in the parking lot because we were out of room. And so that was my first office at DSS. That's now been taken away with the bigger building.
Okay. And 24/7,
Yes.
there's someone on call.
Yes, not necessarily at the office, but on call. Yes.
Right. Somewhere. Okay. So what is the best part of your job?
I mentioned people saying, give in our customer service surveys, talking about how they were able to come and get help here. I think when somebody sends a thank you note, When children go home to their parents, that is a huge team effort. Um, Obviously the parents are doing a ton of work, but there are a lot of people that are working with them to help that happen. When we can intervene and protect somebody from exploitation, all of these things keep me going. I would also say that our team at DSS is also keeps me going. They're really committed. They show up every day. Sometimes, it's really challenging work, but they are creative. They keep a sense of humor. They're willing to help each other out, and all those things just make this a good place to be for me.
Wonderful. Is there anything that I didn't ask you about that you would want to mention to the public?
Not that I can think of.
Okay.
Appreciate the opportunity though to talk about what we do.
Oh, well, this is wonderful. This is it's just wonderful to talk about and wonderful to hear about. And we're going to make this available widely so that the community can learn about the resources here and all the wonderful people who work for DSS.
Great.
So thank you. Thank you very much for taking the time.
Glad to do it.
We're finished.
Okay.
Bye.
Bye.